Tēnā koutou katoa. Welcome everyone to this special extra seminar in the Te Puna Haumaru seminar series. Today's seminar is jointly presented by us and the School of Psychology. It's also part of the School of Psychology seminar series. And it's a privilege to have Jordan Tomkins present today. After this, Jordan is actually going to be sitting the oral exam for her PhD. So this seminar is part of the lead up to that. So without further ado, I'll let Jordan introduce herself. Can't wait to hear it.
Cool. Thanks so much, April. Kia ora koutou, ko oraki te moanga, ko waimakarere te awa, no utatahi aho, ko Jordan Tomkins tōku ingoa, no reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. So hi everyone, and welcome. My name is Jordan Tomkins and I'm just finishing up as a PhD student in the crime lab at the University of Waikato. So I've been in this lab researching family violence for over 4 years, first while doing my master's, and then for the last 3 years doing my PhD. And I've been lucky to have Devon as a supervisor for both, and Lisa as a co-supervisor for this PhD research. So I've definitely come to this research with a passion for family violence work. I started volunteering for Women's Refuge on their crisis line about 10 years ago, and also worked for several years as a frontline support worker at Aviva here in Otatahi, Christchurch. So Aviva is a specialist family violence agency, and at that organisation I worked with both adults and tamariki who were experiencing family violence. And then for the last kind of 18 months or so, I've actually been a shadow board member at Aviva. So yeah, really passionate about this mahi. And it's been really valuable as well to bring a bit of a practice focus to this research. So as April's already done, I'd like to formally welcome you to this seminar. And as she said, it forms the first part of my PhD exam, so quite nervous, but also excited. A big day. And while this seminar might not feel brief to you in the audience, it is actually quite brief, and it's been quite difficult trying to condense down 3 years worth of research into, approximately 3/4 of an hour. So it really is just a brief summary of some of the key parts of this research. We couldn't cover everything today, and I've tried to give it as much of a practice focus as possible, given the nature of today's audience. But yeah, I have had to leave a bit out, so I've put my email on the slide there, and definitely welcome anyone to reach out after the seminar if they want to discuss anything about stalking and this research further. Cool, so just in order to signpost where we're heading today, I'm first going to provide a little bit of general background, mainly trying to situate partner stalking in the wider research literature and understanding some of the basics of trying to define it. Then I'm going to walk you through the first 2 studies in my PhD, which both use police data, and are primarily looking at how frequently stalking is documented in intimate partner violence episodes reported to police, and in turn how frequently police identify and label partner stalking as such. And then in the second study, we explored whether partner stalking was a possible risk factor for ongoing IPV reported to police. Then I'm going to walk you through the third study, which used qualitative data based on interviews with specialist IPV practitioners to kind of more fully explore their understandings and insights about partner stalking. And then what I'm going to do is kind of take a step back and talk through some overall limitations, key findings, and possible implications of this research more as a whole. So often when people think of stalking, they perhaps think of cases involving people stalking celebrities or maybe kind of highly predatory stranger type scenarios. And there are lots of different types of stalking. So this term covers when the aggressor and the victim might be strangers or different types of acquaintances, friends, family, whānau, or people who at some point have been in an intimate relationship. And that's what we're concentrating on today. And we'll talk about it as partner stalking. And of these different types overall, partner stalking is the most common. So estimates generally suggest that around half of all stalking cases are partner stalking cases. And also overall, when we compare partner stalking to other types of stalking aggressors, partner stalking aggressors are more likely to have a criminal history, more likely to use varied and more frequent tactics. The stalking overall is likely to last longer, and it's more likely that violence will occur. So, in other words, we could summarise partner stalking as potentially being more dangerous overall. And so our research focuses on partner stalking within the context of intimate partner violence cases, which I'll refer throughout today as IPV. And in the literature overall, there are some kind of debates that have carried on for a while about how intimate partner violence and partner stalking should be conceptualised. And also kind of fitting into that, the relevance of the aggressor and the victim's relationship status in order to try and define these concepts. So on one hand, and this is typical of the general stalking literature, so when we're looking at all different types of stalking, like I've just talked about on the previous slide, often partner stalking and IPV are conceptualised as distinct but related concepts, and that partner stalking can only occur between ex-partners. So when this perspective is used, abusive behaviours during the relationship are classed as IPV, and then abusive behaviours following the relationship are classed as partner stalking. And then the other main perspective, and this is common in the IPV literature and also common in IPV legislation, is that partner stalking is a type of IPV. So this approach typically defines IPV as involving partner stalking, but also psychological aggression, sexual violence, and physical violence, and that these abusive behaviours all occur within the context of either intact or separated relationships. So stalking is positioned as a subtype of IPV, and relationship status here isn't really that relevant. Instead, specific behaviours are used for differentiating between these different types of IPV. And so for the purposes of this research, we've adopted this latter perspective, so at least as a starting point. So looking at partner stalking as it might happen at any stage within the relationship. So intact, separated, and then kind of everything in between. So we've also made a point of looking for on and off phases. So this is where, you'll hear me talking about this throughout, but where the aggressor and the victim are cycling in and out of the relationship at least once, but it can often be a lot more than once. So with that initial context in mind, I'm going to briefly talk you through a hypothetical police episode report for IPV. And this situation involved ex-partners who I'm going to call Abby and Ben. And basically Ben had showed up at Abby's house, even though she'd recently moved house and she'd tried to keep the address a secret from him due to fears for safety. And so when he turned up, Ben was denied entry. Abby said, she didn't want to speak with him, but he stood outside yelling and banging on the front door. And so at this point, Abby phones police, and the attending officers were told that he'd been calling and messaging her basically non-stop since they broke up about 3 months ago. She also shared concerns with them that he'd hacked into her email and her social media accounts. And so normally when I'm presenting this kind of thing in a room with people, I'll ask whether that counts as partner stalking. Would they call that partner stalking? And ask people to raise their hands if so. But I can't see anyone that's attending here today. It's just blank screen talking to myself, but I'll get you to at least just have a think. Based on the information from that scenario, would you define it as partner stalking? And so now I'm going to just talk you through some of the basic components that are typical of most partner stalking definitions. So obviously an important aspect around defining it is the specific types of behaviour that are included. So from the case example just discussed, the types of stalking behaviour that were present there included the aggressor showing up at the victim's house uninvited, tracking down private information about the victim, in this case her address, making unwanted calls and sending unwanted messages, and also hacking into the victim's accounts. Other types of stalking behaviour that are often included in stalking measures are perhaps the aggressor watching the victim from afar, even sending them unwanted gifts or items, and these can be flowers right through to, I've heard of people leaving bullet casings. So yeah, a really broad range there. And then using technology for a wide range of stalking behaviours. So it could be GPS tracking, it could be monitoring their social media, putting spyware on their, downloading kind of various apps onto their phones, for example. But in order for these behaviours to actually meet the threshold for partner stalking, there are often some common components that are required. And the first is that these behaviours must form a repeated pattern. So typically this means at least 2 incidents, although some researchers require at least 5 incidents or specify, for example, that the behaviour must last longer than 2 weeks. And then next, these behaviours must be explicitly unwanted by the victim. And this sounds kind of obvious because, of course, they're unwanted, but it's particularly important with some types of stalking behaviours because some of those behaviours that I've just talked about on the previous slide can be normal or even wanted in non-abusive contexts, such as obviously phone calls or turning up unexpectedly or leaving some types of gifts as a surprise. So it is actually really important that the behaviours are explicitly unwanted. And then finally, victim fear or some level of distress is also important. And often legal definitions for stalking will specify that even if the victim themselves isn't fearful, that a reasonable person in the same situation would find the behaviour fear-inducing. Although this component is often less consistently included. And we didn't require evidence of it for our measure of stalking in this research. Right, so now I'm going to turn to the first study with some of that background in mind. And this considers the problem of partner stalking within the context of policing, which is obviously a highly relevant practice context for a lot of the people in the audience today. And also given that police represent gatekeepers to the criminal justice system, and also in New Zealand provide a really key referral pathway to a lot of wider social services. It also gives us a useful kind of initial sense of this problem because statistics on partner stalking aren't systematically collected in New Zealand. So it's quite hard to get a handle on the problem. So key research questions for this study were how frequently is partner stalking evident in cases of IPV reported to police? And then with that in mind, how frequently do police explicitly identify and label partner stalking as such? And then focusing on the relationship status between aggressors and victims, how frequently did we find evidence of partner stalking recorded across the different relationship categories? So intact, on and off relationships and separated relationships. And then to answer these questions, we used the following method. So we sampled over 1,000 cases with at least one IPV episode reported to New Zealand Police. And we read through all of the IPV episode reports within a 6-month period for each case. So as you can imagine, some cases actually had quite a high number of reports over that 6-month period. And then what we did was manually code partner stalking from this information. And alongside that, we also collated several police recorded variables, and this just gave us wider context about the cases. And then in turn, we analysed this data. So some basic information about the sample, and this is for both this study and the second study that I'm going to talk about today. Almost 85% of aggressors were men and 85% of victims were women, and 98% of cases that were sampled involved aggressors and victims of different genders. Aggressors and victims were also pretty similar ages. So the average age of aggressors was about 35 years old, and the average age of victims was about 33 years old. And then almost 95% of sampled aggressors and around 80% of the victims were identified by police as either Pakeha or Mauri, and there were almost identical rates across both of these ethnicities. So that gives us a little bit of context about the sample. And then we identified a pattern of partner stalking in 14% of these cases. So in other words, approximately 1 in every 7 IPV cases that were reported to New Zealand police contained information that met the definition of partner stalking. And these findings were consistent with prevalence rates that were also identified in quite a small number, but similar studies that were conducted in the United States. So, together this suggests that police episode reports for IPV do commonly include statements that indicate the presence of partner stalking, even though there's quite different legislation and kind of police policies and practices in New Zealand and in the States. And despite this documented presence of partner stalking, in many of the cases, few of the attending officers explicitly labelled it as stalking. So our results showed that police referenced stalking in 8%, or 1 in every 12, roughly, cases that met this criteria for partner stalking. And again, this was quite similar across those same studies from America, suggesting that police across different jurisdictions may be under-identifying partner stalking in IPV cases. But kind of an issue with this, and what remains unclear, is whether low partner stalking identification rates mean that police are potentially completely overlooking stalking behaviours and not accounting for it in their appraisals of harm and perhaps their risk assessments, or whether they're in fact kind of clocking it but labelling it as another form of IPV, so potentially contributing to their perceptions around psychological IPV or coercive control. And we're going to talk more about that a bit later. So focusing on the frequencies regarding the different types of relationships that were evident in cases with partner stalking. So relatively few partner stalking cases involved intact relationships where the aggressor and the victim were still together, but there was some evidence of it, so almost 10%. And then both on and off and separated relationships were identified at similar rates in the cases with partner stalking. And these two relationship categories accounted for, over 90% of all partner stalking cases. So based on this, these findings suggest that regarding relationship status, partner stalking might be best conceptualised as a phenomenon that occurs mainly, but not exclusively, outside of intact relationships, and then across both periods of on and off relationships, so relationship instability, and then also post-separation. And then as an interesting aside, we also found that we looked at potential differences between cases with and without stalking. And what we found were partner stalking cases were more likely to involve shared children between the aggressor and the victim, which makes sense because there's that ongoing other reason to stay, in contact and complicating factor. There was also more likely to be drug use involved. The aggressors were more likely to be identified as European rather than Mauri. And in terms of some types of harm that were more likely to be present in this partner stalking cases, there was more likely to be property damage, threats of harm, and weapon use. Although we emphasise that these findings in particular are really exploratory and definitely need to be looked at further before they could be used to inform practical implications. Cool. So now I'm going to turn to study 2, which, as I flagged at the start, builds on the previous study, also uses police data and considers kind of one aspect of why we might be concerned about the presence of partner stalking in these IPV cases, and that's relating to risk assessment. So given the high pressures on police to respond to IPV-related demand, it's really useful if research evidence can support risk assessment and triaging processes. And so examining risk factors for ongoing IPV is therefore really relevant and important for both researchers and practitioners alike. And so considering one such possible risk factor is partner stalking. And there's actually a lot less evidence for partner stalking as a risk factor than people might assume. And also it's not included in a lot of the IPV risk assessment tools as a standalone stalking specific item. And given the processes that go typically into place for creating these risk assessment instruments, that might suggest that actually it's not as useful a risk factor as people sometimes assume. So the New Zealand instruments, the SAFER and the DIRA, they don't include a partner stalking item, and then neither do the SARA or the ODARA, for example. And the ODARA was one that we also use in New Zealand. And then the United Kingdom uses one called the DASH, and this does include a stalking specific item. So with this background in mind, we wanted to explore whether partner stalking was a possible risk factor in the New Zealand practice context. And again, we used this method. So we used the same sample from the previous study, but a small number of cases had to be deleted because of missing data, so it's just slightly smaller. And then we used 3 key predictor variables. So as I've hinted at, partner stalking was one of them, and this was based on the variable that we measured in the last study. And then we also looked at risk level. So this is based on the variable that New Zealand Police call total level of concerns for safety, and I'm sure some of you will be familiar with that. So basically it classifies the risk as low, medium or high overall, and it's automatically calculated from combining the results of the police's 2 current risk assessment instruments, the SAFER and the DIRA, and recall that neither of those include the stalking specific item. And then we also looked at multiple baseline episodes. So whether or not a case had more than one IPV episode reported during that baseline to get a sense of kind of, the recent frequency of call-outs. We then followed each case for a further 12 months and analysed the relationship between these 3 predictor variables and then 2 outcome variables. So the 2 outcome variables of interest were any IPV recurrence. So this is basically a call for service to police relating to IPV, irrespective of the severity of the harm or whether or not this episode resulted in offence detection by police or whether anyone was arrested. So it's quite a broad measure. And then we also measured physical IPV recurrence. And so this captured whether police detected any level or any type of physical violence in any of the IPV episodes that were reported during that follow-up period. And so overall, and for a bit of general context, over a third of the sample had at least one IPV episode reported during the follow-up period, so over those subsequent 12 months. And then almost 1/5 of the sample had at least one IPV episode that involved physical violence during the follow-up period. So first we looked at whether partner stalking by itself predicted any IPV recurrence. And we found that there was a statistically significant relationship, but that partner stalking was a really weak predictor. So this ultimately means that it didn't do a very good job of predicting IPV recurrence. And then we looked at whether partner stalking added any additional risk prediction benefits over and above already knowing about the overall risk level and whether there'd been multiple IPV episodes recently. Excuse me. And the results showed that partner stalking wasn't a significant predictor of IPV recurrence in this analysis. So overall, the overall risk level and multiple IPV episodes significantly predicted IPV recurrence, but partner stalking didn't. So that means that partner stalking doesn't add any unique risk prediction information here over and above already knowing about these other two risk factors. And then we repeated the same two-step analysis, but using physical recurrence as the outcome. And here, partner stalking didn't significantly predict physical recurrence at all, even when it was analysed by itself. And again, overall risk level and the presence of multiple recent episodes both significantly predicted physical recurrence. But over and above these two factors, partner stalking wasn't a significant predictor. So together, this analysis demonstrated that there are other risk factors that are much better predictors than partner stalking for both outcomes. And this suggests that perhaps partner stalking may not warrant special consideration, at least when we're trying to predict the risk of ongoing harm as measured by any recurrence and physical recurrence. And also kind of makes sense then as to why most of the IPV risk assessment instruments don't include currently a stalking standalone item. So more research is definitely required, but these findings do represent a building block towards informing evidence-based guidelines around risk assessment. And kind of note, we're only talking about risk assessment and prediction here. We're not talking about ongoing risk management. And so changing tack slightly, after doing the research with the police data, which is obviously interesting and valuable, but it does only give us one piece of the puzzle, mainly because we're reliant on cases that have actually been reported to police, and then also that we're reliant on the information that's actually been recorded by the attending officers. And this can vary quite a lot from episode report to episode report. So we went in a slightly different direction in the final study. And originally what we were hoping to do was talk to both victims and aggressors and get a better sense of their actual experiences regarding partner stalking. But when we were in the kind of data collection and planning phase, this was all happening in COVID times. So as everyone's well aware, things were just a lot more complicated than normal. And as a result, we ended up recruiting practitioners instead. But this turned out to be a really useful pivot because overall something that we've been really interested in this research project is about how, multiple decades worth of partner stalking related research still remains quite inconsistent, and there is still a lot of confusion around it. So we wanted to talk to practitioners and get some sort of sense whether some of these same issues that we're seeing in the research literature are mirrored in practice and in their understandings. And so as a result of kind of that background, we asked practitioners how they defined and understood partner stalking in IPV cases. And we wanted to know what they thought about the relevance of relationship status. We also wanted to know whether practitioners distinguished between partner stalking and coercive control, and if they did, how did they do it? And then also get a sense of practitioners' views about the overall IPV sector's kind of competence in understanding and responding to partner stalking. And so the method for this study, we recruited 14 practitioners from across 7 agencies here in Ōtautahi Christchurch, and this included 3 kaupapa Māori agencies. So 7 of the practitioners interviewed primarily worked with victims, 5 worked with aggressors, and 2 with both. And each interview lasted approximately an hour. We audio recorded each interview, and then I transcribed them word for word, and this transcription process produced over 120,000 words, or around 250 pages of raw data. So we had quite a lot to work with. And then what we did is conduct thematic analysis. So we generated initial codes based on analysing the transcripts line by line and as a whole using in vivo software. And then after we'd completed this process for each transcript, we collated all the initial codes and checked for kind of differences and similarities across the transcripts, and then used that to create kind of diagrams and look for patterns in the data. And from there, we generated some important themes. So when asked to define partner stalking, most practitioners listed types of behaviour that they perceived as characterising partner stalking, rather than giving any kind of overall conceptual links about what they thought about partner stalking. So they typically listed behaviours such as the aggressor following the victim, showing up at the victim's house or work, involving third parties to follow the victim or gain intel about them, hacking into the victims' online accounts, using GPS tracking, these sorts of things. So stereotypical surveillance and monitoring type behaviours. And as you remember from the start of the presentation, these are behaviours that are most consistently included across different stalking measures. And then we explored kind of whether and how relationship status was relevant to their definitions of stalking in IPV cases. So this varied quite a lot, both kind of within interviews and across the interviews. So sometimes practitioners said that partner stalking can only occur between ex-partners. And obviously in saying this, it suggested that relationship status was a really relevant factor for them in defining partner stalking. And then at other times, practitioners said partner stalking can occur in separated or intact relationships, and that kind of suggested that relationship status wasn't so relevant in their definitions of partner stalking. And then also at other times, practitioners said partner stalking was possible between current and ex-partners, but that it mainly occurred between ex-partners. And overall, when practitioners spoke about specific cases, those partner stalking cases basically all involved ex-partners. So that emphasis suggested to us that kind of regardless of what people were saying directly about relationship status, separation does appear to be an important factor in how most practitioners understand partner stalking. And also perhaps a bit of a disconnect between maybe what people were saying or thinking at kind of an abstract theoretical level versus what they were seeing in practice. And so we took this to suggest that most practitioners, either implicitly or explicitly, considered partner stalking to represent a concept that is mainly occurring between ex-partners. And then turning now to that relationship and possible overlap between coercive control and partner stalking. There's a lot of confusion about this in the research literature. And coercive control is also, like stalking, quite difficult to define, and researchers disagree over the definitions, but broadly refers to a pattern of behaviours that are used by the aggressor to humiliate, isolate, intimidate, and punish and frighten the victim. And in the interviews, practitioners did appear to be using a lot of different terms, kind of seemingly interchangeably. So stalking, harassment, controlling behaviour, coercive control, and often it wasn't clear yet whether there was any rationale that was driving the use of different labels. And the findings showed two main perspectives on the possible overlap between partner stalking and coercive control. Basically, either that they were perceived as overlapping concepts or distinct concepts. And so for those who thought partner stalking and coercive control represent distinct concepts, there was actually still kind of more differences or confusion in how this differentiation was made. And it was either based on relationship status or specific types of behaviour typically. So when relationship status was used to make the distinction, partner stalking was often conceptualised as something that occurs in separated relationships and coercive control as something that occurs in intact relationships. So the behavioural differences weren't emphasised, and it was just about the relationship phase in which they occurred. So, for example, if an aggressor followed a current partner, practitioners talked about this behaviour contributing towards a pattern of coercive control. And then if that aggressor followed an ex-partner, the same behaviour contributed to a pattern of partner stalking. And then, on the other hand, when using behaviours to make this distinction, there were specific types of tactics that were thought to demonstrate either partner stalking or coercive control, regardless of where they happened in the relationship. So it didn't matter if they were happening for ex-partners or current partners. And the partner stalking behaviours are the tactics that we've already talked a lot about here today. So following the victim, tracking their location, and so on. Whereas the coercively controlling behaviours that were articulated were tactics like put-downs, financial abuse, threats, intimidation. So this gives an example of one of these perspectives that I've just been talking about, where they're thought of as distinct concepts and relationship status is the main way that that's being made. And then the other main perspective was where practitioners instead framed partner stalking and coercive control as highly overlapping concepts. And here, partner stalking was often defined or understood as one type of coercive control and often a way of maintaining coercive control. So here, practitioners regarded relationship phase as irrelevant. Both partner stalking and coercive control were thought to be possible across intact and separated relationships. And in fact, kind of behavioural differences between the two were also disregarded. So both were used as kind of catch-all labels that covered a wide range of abusive behaviours. So yeah, relationship status and behaviours not used as the differentiator. And again, here's some quotes that provide examples where someone's saying, I think stalking and coercive control are the same thing. Maybe it's all just coercive control. I've never really separated them out. So kind of taken together, a key finding was the major inconsistencies in whether or not practitioners distinguish partner stalking from coercive control. And then if they did, how did they do it? And so these findings do raise questions about how easy it is in practice to identify and potentially distinguish between these two concepts. And perhaps a lack of clarity in terms of what both terms mean. And this confusion is absolutely mirrored in the research literature as well. So then, lastly, zooming out a little bit, we spoke with practitioners about their views on the IPV sector's current kind of understandings and competencies maybe around partner stalking. And first, practitioners were really consistent in emphasising partner stalking as an important issue. So they often talked about it as being quite dangerous, maybe referring to it at times as like a red flag or a high-risk issue. And there was also, considerable emphasis around the relevance of partner stalking for risk management and clinical practice in general. But the practitioners did have quite varied views on whether they thought that the sector kind of overall had a good understanding or grasp on partner stalking. So some practitioners said that, partner stalking is widely understood among practitioners and across agencies. It's accurately assessed, it's clearly identified. Practitioners communicate really clearly on this issue. Others said kind of the exact opposite. So expressed concerns about different levels of understanding and issues around identifying it, communicating it, managing partner stalking cases, and especially when cases involved, cross-agency collaboration, uncertainty around whether everyone's on the same page about stalking. And these practitioners, where they were raising these concerns, also kind of flagged their worries about a lack of partner stalking specific training that either they'd received or that was, being delivered more widely. So that's a quick run through, really quick, of the three main studies. And now I'm going to kind of pull back even further and just try and talk about some of the key considerations for this research overall. So some of the limitations, just briefly, and this is important to keep in mind as we're talking about the key findings and the potential implications. So focusing on the first two studies using police data, obviously there are some limitations inherent with using police data. We can't generalise about IPV cases that are never reported to police. And as I touched on earlier in the presentation, we're reliant on what the attending officers decide to record in the episode reports. And if the information isn't there, then we can't use it in the research, even if it did happen. And so New Zealand Police, at the time of data collection, weren't collecting partner stalking specific information in any kind of systematic way. There's a lot of kind of tick boxes for other types of harm, but not for stalking. So there's no kind of prompt for attending officers to specifically ask about this. So there may have been undocumented stalking, partner stalking, present in some of the cases that we then categorised as non-stalking because we couldn't account for that in this research. And issues with this is that it would result in underestimating the prevalence of partner stalking in these cases, and then depending on how widespread that was, compromise our ability to accurately analyse the relationship between partner stalking and ongoing IPV. And then the intervention data. So this was an issue where, particularly with the risk prediction analysis, may have impacted our findings, and that we couldn't easily account for whether or not interventions had been successfully delivered during the follow-up period. And obviously, if there had been really successful, safe interventions that had happened in some cases, that would affect the relationship between stalking and ongoing IPV outcomes. And then focusing on the interview study. So the way that we presented some of these themes almost suggests that perspective kind of like types existed, especially regarding partner stalking and coercive control. And this was essentially just to help overall clarity, but actually most of the practitioners contradicted themselves to differing degrees across these perspectives, again, just kind of highlighting the difficulty of these concepts. And often practitioners actually did directly acknowledge in the interviews that, they'd never really thought about some of the issues we were discussing. And they appeared to be kind of thinking out loud during the interviews as they tried to make sense of it. Which is totally fair. But yeah, it's not as clean as we kind of presented in the findings. Then there were some issues around recruitment and sampling. So the overall sample size was smaller than what we'd initially planned. Again, flow-on effects from the pandemic, I think, were a big reason for this. But the interviews did produce really, really rich data. So only having 14 participants might not be as big a limitation as it maybe sounds. And then just another consideration is that participants self-selected into this sample. So it may be that they had a specific interest in partner stalking or a reason for wanting to be involved. And so their insights may not reflect the diversity that is across practitioners in the whole sector. And it probably almost certainly doesn't reflect the views of practitioners who work with other types of stalking rather than just general partner stalking. So some key findings were that practitioners definitely emphasise partner stalking as important and often a dangerous issue. And there was, good consistency around the types of specific behaviours that are thought to represent stalking, and that it's often, it's common, it's often present in IPV cases reported to police. But on the other hand, a lot of confusion and complexity does still persist. And again, this is in the practice context that we focused on in this research, but a lot of these concerns and confusions are absolutely mirrored in the research literature as well. So, for example, despite people often talking about stalking as a red flag behaviour, it was a really poor predictor of ongoing IPV in this study, and there's limited evidence to suggest that stalking is kind of useful for risk assessment overall, over and above other commonly used risk factors. And again, here we're saying it may not be an important risk factor for risk prediction, but we're obviously not saying that it's not important for wider risk management and clinical practice. And then even though partner stalking was, frequently detectable in police episode reports for IPV, the attending officers didn't often explicitly identify and label it as partner stalking. And again, so we don't know whether this is because police are overlooking it or perhaps including it in their appraisals of coercive control. And then that links in with this kind of ongoing confusion that I've been talking about today around whether or not to differentiate between coercive control and partner stalking. And that was a major issue among the interview participants as well. And so as a result, there does appear to be a lack of consensus around how police and specialist IPV practitioners, and we didn't look at it, but quite possibly, other practitioners in the wider criminal justice and social service sectors that might be using key terms like stalking, harassment, controlling behaviours, coercive control, psychological abuse in different ways. And so I guess a concern with that would just be around the shared understanding of these labels and these terms, and whether people are using the same terms differently without realising it, which could make accurate risk assessments and clear communication and safe case management more difficult. And then this ties in with some practitioners' concerns about the need for stalking specific training. So obviously a potential recommendation could be rolling out partner stalking specific training across the sector, particularly with that focus on improving shared understandings and language and accurate identification of partner stalking. And I'm conscious in New Zealand that obviously there's been a lot of conversation happening around improving legislation for partner stalking. And this research, hasn't looked at anything directly to do with that at all. So I'm not in a position to give an opinion one way or another, but more just that if that legislation was to roll out with other or improve with other levers not in place, I'd be concerned still about, identification and shared understandings and everything like that. So again, I think training would be important to support any potential changes in legislation. And then another potential recommendation is just around monitoring partner stalking related trends and patterns. As I said, it's not collected in any kind of systematic way currently in New Zealand. And so accurately accounting for the prevalence rates on, a much larger scale than we've been able to do in this research is such an important first step for informing resource allocation and obviously practice and policy recommendations too. So I think overall there are significant opportunities for both practitioners and researchers to work together to better shape our understandings of and our responses to partner stalking. And this research hopefully has provided some useful first steps, at least kind of highlighting some of the confusions and contributing to what is quite a limited evidence base about partner stalking in New Zealand. So then finally, I just want to say that's the end of the presentation, but I want to say a massive thank you to all of the people behind the scenes that have helped this research get to where it is today. It's obviously only been me presenting, but there are a lot of people behind the scenes that have helped So yeah, I just want to mihi to all of these people and organisations for the support they've provided. So thank you.